We've been with HR for Health for 9 or 10 years, and I would not consider doing business without them. In fact, I consider them part of our team. They're easy to work with. The team is very helpful, very communicative. Whatever situation arises in the practice that I don't know really how to handle, I reach out and they help walk me through it. Again, I look at them as the experts on HR, as I look at us as the experts on eye care. Frequently in my role with Vision Source, I get to interact with our 3,000 offices across the country, all independently owned and operated. And I get asked HR questions. HR comes up frequently when we talk about managing people and our teams. Often doctors will say, "Hey, I don't need to pay somebody for HR. I can do it. Here's the situation that came up, and here's how I'm going to handle it because it makes perfectly rational, logical sense to me." And I have to remind them that state, local, and federal laws aren't always perfectly logical and rational. One of the newer features with HR for Health, it's been a couple of years, I think, but is their payroll. And we used to take the time clock and time hours from HR for Health and send it over to our payroll processor. But when HR for Health really integrated payroll, it made life incredibly easy. I can process payroll in about 5 minutes. It takes me a little bit longer because I'm slightly more detail oriented and I want to double check everything, make sure it's right. But being able to approve hours and approve payroll and submit payroll and really have just one path with HR for Health, one contact, has been very, very helpful. And our team enjoys it as well because it makes it easy for them to get all of their payroll needs if they need to pull pay stubs or whatnot. Super easy. And again, all of it is electronic because that's how we've chosen to operate. So all the direct deposit staff gets emailed their pay stubs, makes it super helpful. When things have gotten scary and dicey, they've been a rock through the entire process and have always been there for us. And so I appreciate them and would highly recommend anybody who is running a small practice to reach out to HR for Health, have a conversation with them, learn how they can help you in your HR needs.